Hello, Jeando.
Hello, Kevin.
So one of F.M. Alexander's main themes is coordination. And in the first book, he says that his method is based firstly on the understanding of the coordination of the muscular mechanisms, and secondly on the complete acceptance of the hypothesis that every movement can be consciously directed and controlled, and that that therefore the first duty of the teacher is to the education of the conscious mind, and this is what re-education and re-educating actually means. So can you talk about how coordination is really an intellectual problem? Because I think a lot of people just assume it's coordination is a physical thing that you have. So can you talk about how it's better to look at it as an intellectual problem, and tell us some of your understanding of Alexander's explanation of coordination?
Yes, it's a very central topic in all Alexander's books, not only in the first one. And I think it's a forgotten principle or forgotten topic in the treatment of that is given to the Alexander technique by the modern Alexander technique teacher. That in my view, I've gone to a somatic approach, which is completely at odds with Alexander's thinking. So let's go back to the beginning, and the beginning is how Alexander sees our problems, and for that we go back to his approach, and this can only be his written approach nowadays. So let's have a look. I will show you. I want to start with this idea that he sees our problem as a deterioration in general coordination. So what he says is that owing to the limited range of the working of his reasoning processes, he, which is man, must have concluded that his general shortcomings, which are physical and mental, were due to specific movement shortcomings. And this narrow and erroneous conception led directly to the idea of movement development by means of specific exercises to be performed at specific times for the purpose of developing specific movements. It will be evident that such a process could not satisfactorily check the deterioration in general coordination and the maladjustments and misplacements to which I have referred. So Alexander has discovered that while performing simple acts, sitting, standing, walking, just breathing, it could be shown that we were in fact producing what he calls misdirected activities. And to understand misdirected activities, you have to have this idea of general coordination in mind, because Alexander sees that the direction of the use of the mechanisms directs a connected series of acts. Any end, making a goal stroke, typing on a keyboard, even being just sitting and speaking to a camera, involves a coordination of a series of preliminary acts. That's what Alexander's conception of coordination is. There are different movements of different parts that, occurring at the same time, allow us to assume a certain position. It's not the position that is faulty. What is faulty is the organization of the movements that lead to assuming that position. So there is a problem of direction, of course. The direction Alexander is talking about is a new direction of the pupil's general use. It's very important to understand that the problem of direction is not a problem of direction of a specific movement where between the neck and head, or between I don't know, the different ribs of the breathing mechanism. For him, we must build a new direction of the pupil's general use. And when you take the problem in this way, you suddenly realize that the teacher cannot build that direction. It can help the pupil build the direction, but it cannot build the direction for the pupil. This idea that the teacher can take charge is very curious if you keep in mind that the direction of use is the direction of coordinated general use. The teacher has only two hands. So for some people that are listening to us that are not having lessons with any of us, that do not understand what is the initial Alexander technique way of teaching, it's better if I give a sort of explanation of the direction of the pupil general use. Most people are directing their general use all the time according to the feeling sense. That's how the child develops. That's how the coordination between the mind, which is the intellectual part, and the physical part starts to grow. I've already explained this in the last episode. And according to that, it's possible to show that, for example, the person is shortening the torso as a habit during a special movement. It's very easy to reproduce. You just need to, for example, ask the student who is performing in front of a camera to create a simple gesture which will involve feeling slightly out of balance, very slightly out of balance. So the pupil cannot but feel that is slightly out of balance. And when that is happening, you will find that the person will, in fact, command a series of acts. The rib cage is going to rotate, the pelvis is going to rotate too, and most of the time the ankle is going to be involved. And it will be seen that the reaction of the person to the feeling of imbalance is a coordinated series of acts. All these rotations of the different parts I've just mentioned are going to happen at the same time. The question is the person aware that she's commanding these actions? Well, it's very, very simple to show that it's not, that the person is not conscious of reacting by directing a series of rotations. That's the first thing. And when you ask a person whether she has rotated the ankle outward externally or internally while reacting to the subtle feeling of disequilibrium, the person will not know what you're asking. The person has no idea that she has done that movement. And even when the person is watching herself on video afterwards, looking at the reaction, the person will have difficulty noticing the different movements. You'll have to indicate to that person the different movements and show sometimes opposite reactions that do not involve this kind of rotation, for the person to start to see. Because when looking at a person just reacting to a slight disequilibrium, most people at first do not know how to see what is really happening. This is also part of this coordination absence of realization. You see what you know is there, what you want to see. And if you're not trained in looking at coordination of movements, most of the time, you're not going to be attracted to several movements occurring at the same time. You have to have them in mind at the same time. We are not asked to concentrate on the ankle rotation or on the rib cage rotation or on the pelvis rotation. We want to see how these rotations are, in fact, coordinating together. What is the person performing? It may sound strange, but I spent a lot of time developing the capacity to see these movements. Once I discovered that for Alexander, these coordinated series of acts to be carried out all together, one after the other, was the central part of thinking in activity. But at first, it's as if I would watch at somebody sitting or standing from a chair, and I would say, well, he's tight, he's is this or is that. But before becoming capable of nearly instantly noticing what was the coordination of the different rotation, it took me years. So nowadays, of course, I train the students and teachers to see these movements much quicker. And the way for that is very simple. I command the pupil to, in fact, program, perform a series of definite rotations. When you're instructed to carry a rotation with the chest and a rotation with the pelvis, it becomes much easier to see that you've not done so when you perform. And when you notice that you have not done so, your acuity of distinguishing movements increases tremendously. That's why I ask all my students to video themselves, to practice and take a real objective view of their actions. Not so much for them to repeat the coordination, the guidance, but really to develop their acuity in realizing that going to stand, for example, from a chair involves a certain rotation of the ankle, so that when they start going up from the chair, they understand that their objective, their goal is, for example, for the back of the knee to touch the chair at a certain moment. And in that way, when they watch the video of their gesture, well, it's easier for them to, in fact, centralize all these informations about the rotations of the different movements, and at the same time verify that they're performing the action they want to perform, but also at the same time constructing an intellectual model of all these rotation happening at the same time, and leading to a common consequence. That is, for example, a very interesting procedure is to go from sitting to monkey. In the modern Alexander technique, we are trained to go into monkey. But training to go into monkey in the somatic way, in fact, repeats an experience where you're standing and you go into monkey. So it's in a certain way, you could say that you flex into monkey or you go down into monkey. Going up into monkey from sitting is a completely different affair, in the sense that the feeling you're going to get from sitting to going into monkey have nothing to do with in fact, the feeling you're going to have when going from standing to monkey. So what is interesting in this example is that the direction of the movements, or the direction of the coordination, of the general coordination of these movements, is the same going from standing to monkey or from sitting to monkey, while the feeling is completely different. which is quite interesting and shows us that we can work with principles when we direct the decision of movements, while there is no principle working when you are trying to feel what is happening somewhere, what is the correct coordination in feeling. So this problem of coordination is directly linked with the problem of faulty sensory appreciation. There is a mistaken view with faulty sensory appreciation that Alexander is talking about. I am not feeling properly the movement at the wrist, or I'm not, my sensory sensitivity of the movement of the chest is not sufficient. This is not what Alexander is talking about. Faulty sensory appreciation does not correspond to faulty feelings. It corresponds to something different. It is the impossibility with feeling to, in fact, understand coordinated movements. It's the impossibility of feelings to build a new coordination, a new general coordination of movements, a coordinated series of acts has no feeling that you could recognize. There are too many feelings happening at the same time for a person to be able to say that the person is making decisions. You do not make a series of decisions of movements according to a general feeling. It's very clear that for Alexander, he's never told about faulty sensory appreciation in the sense of poor sensory discrimination. It's impossible to imagine that you could rotate the ankle and rotate the rib cage and relate the two rotation in space. Well, of course, you have to understand that the ankle, Alexander says the movements start at the ankle. Let me explain. You have a person standing in front of the chair, and the person has the back of the leg touching the chair, so that we know exactly how the ankle state is at the start of the game. So the person is standing, and you will find that the person is standing with the leg vertical, because Alexander said that the limbs should be influenced and aided by the force of gravity. And as the force of gravity direction is vertical, we ask the person to place the legs so that they are seen vertical when we look at the person from the side. This leads to the person feeling a slight sense of disequilibrium. It's not the way. The way the person stands, the person stands with a release in the ankle so that the knees are slightly flexed. How is it that Alexander says that the movement starts at the ankle? Well, the movement starts at the ankle because when the ankle is released in this way, so that the person feels no tension in the knees, for example, that's a habit, you will find that as a result, well, the foreleg, the front leg, is inclined forward. And so the lower torso and possibly the middle torso are quite far forward of the ankle. The person feels absolutely upright because at the same time, she's rotating the rib cage backward at the top. And the center of rotation of that rib cage is at the spine, at the back. That's what we can judge from looking at a picture. And so the movement starts at the ankle means something strange. It's that it's not the movement of going to sit or going into monkey that starts at the ankle. It's the standing movement. Alexander considered that what we call a position like standing, for him, is not. For him, it's a movement. The movement starts at the ankle. And if the person has a released ankle, it will be seen that the person is arching the back, shortening the back, protruding the abdomen, and showing all the misdirected activity Alexander is talking about when he talks about faulty coordinated series of acts. the faulty coordinated series of acts starts at the ankle. There is an act. The person, without knowing it, is moving the knee forward of the ankle. That's the preferred stance. And as a result, there is a movement of the middle torso forward, and there is a movement of the upper torso back to maintain poise. It's a wrong idea of poise because it's a poise that is associated with the shortening of the back. And Alexander considers that if the series of movements leads to a shortening of the torso, then this is a misdirected coordination of movements. So comes the idea of now finding a solution. To find a solution, Alexander points to first the problem of direction. And he says that the problem of direction of the person is due to this, what he calls a misdirection. So you have to understand that the misdirection is a misdirection of the general coordination, not the misdirection of the ankle. There is no point asking the person to, in fact, change or feel the ankle, feel if the ankle is released and stop releasing the ankle. The problem is not the ankle. The problem is the coordination of all the movement that follow this release of the ankle. So asking the person to feel is bringing the person even more into this problem of misdirected activity, because the misdirected activity is due to the dependence of the direction of the movements to the feeling sense. So this is the center of Alexander's thinking. This is for example, when we talk about the end-gaining conception. For Alexander, the end-gaining conception is a decision that the person is making according to wrong, in fact, premises. He says when an end is desired, all that is necessary is to proceed to employ the different parts of the organism in the manner which your feeling dictates as necessary for the gaining of the end. The problem is that the feeling dictates misdirected activities as a whole. It's not the problem of directing the feeling on one specific part, the ankle. The problem is the relationship between the position of the upper chest, the position of the middle chest, the middle torso, and the position of the lower torso relatively to the ankle. So we are not equipped at first to feel what it is, what is the spatial correlates of three different bony parts of the torso in relation with the ankle. This is impossible to imagine that a person could, through a somatic re-education, obtain that sort of idea. Because it's an idea, it's a representation, it's a model. It's not a physical, it's not grounded in, you could not say, well, because I feel the ankle in this way, or I feel the middle torso in this way, I should be close to the mark. Well, if there were two spots to correlate, it would be possible. But as there are four, it's impossible. It doesn't make any sense. So the difficulty is that nowadays people are giving to this problem a completely new explanation. Nowadays, the Alexander teachers, the modern Alexander teachers, consider that the problem is not really sensory appreciation. For them, sensory appreciation is not that untrustworthy. If they direct their attention to a rib cage, for example, they can feel whether the rib cage is moving or not. And even when they feel that it's not, They find that just directing their feeling to the rib cage will help the correct movement to suddenly happen again. The rib cage, that is restriction of movement, is going to be liberated by just directing their attention to the feeling of the rib cage. And so I have different example that I want to talk about, because it's quite interesting to situate the way of the initial Alexander technique to compare it to modern ideas. So I have two different kind of somatic teachers. One is Feldman. He's an American teacher that trained with Marjorie Barstow, I think, and he's just published a new advertising for his training, and the training is called a Grace of Sense. And here is what you can read. It's on the internet. It's easy to find. It's everywhere. What you can read on the, I will show you. We are all endowed with senses. True, some of us do not have all of them. There is a very simple way to understand what happens to our senses. As our motoric activity increases, often our conscious sensory receptivity decreases. The result is that our actions are not as informed as they could be, which often makes them less accurate, more effortful, less effective, and sometimes inappropriate. By conscious sensory receptivity, I mean the awareness of sensory input. The diminishment of conscious sensory receptivity prevents us from experiencing how we are doing, what we are doing, as we are doing it, reducing our ability to delight in and appreciate life as we are living it. So in this example, we see that the problem is not a problem of direction of general use. The problem is, in fact, that our sensory awareness or sensory receptivity is in a way diminished. And because this sensory receptivity is diminished, then we cannot delight in life. What it means is that the training that is offered by this somatic teacher is to increase sensory receptivity. You must note that in the whole presentation of Mr. Fatman, there is no mention of the word coordination or general coordination. This has completely disappeared. What is presented is that the faulty direction is a faulty sensory direction. And the solution is to improve the sensory direction. This is a completely different idea from conscious guidance and control, you must understand. This is pure somatic teaching. It's nothing. Well, for me, of course, it's a bit funny because most of the time I'm accused not to teach the Alexander technique. But for me, when I look at these advertisements, I see the definition of engaining. Simply, it's all that is needed is to restore the feeling sense, and to restore the feeling sense, you have to in fact drive your attention toward the feeling sense. And this is not the only example. I have another one that is really interesting too, from a completely different style of teacher. Is a teacher that would never accept anything Fatman would say. It's a gentleman that is called Smith, that is a Canadian teacher. I think he was trained with the McDonald style, and his view on the problem is again completely apart from that of Alexander, is that the idea of general coordination of a series of acts does not exist in his view. So let's have a look. So you remember with Mr. Fatman the idea that as the motoric activity increases, the sensory sensitivity decreases. You will see that here the problem is seen differently, because for Mr. Smith, it's when the motoric activity decreases that the sensory receptivity decreases. So Mr. Smith proposes to, in fact, direct the attention toward the different movements and decide to increase that movement so that the sensory receptivity will increase. What I'm getting at here is that the problem of self-perception is not aided by ignoring sensory input, by imagining that kinesthesia is somehow wrong, and the solution is to appeal to thinking. But instead, I am suggesting that thinking is the problem, and that the solution to the problem is to pay attention to true sensory kinesthesia. In other words, to change the idea rather than ignoring the feeling. Because most of us have successfully shut down perception to an alarming degree, retracting the body inwards, restricting the movement necessary for perception. For, as I stated before, the senses are comparators and require movement for their functioning. I am suggesting that changing habitual posture requires a will to perceive. This will to perceive is what we need to have when we attempt to expand our field of perception to include both the self and its environment. It is what we do when we direct, which is inhabitating our bodies to the tips of the fingers and toes, to the top of the heads, to allow the natural outgoing nature of the body to be. It's a nice end. But the main concept here is again a somatic concept, that the direction of the coordination, of the general coordination, is the feeling sense. And so they are misdirected activities. So we must direct our attention to the feeling sense to re-educate our feelings. It's a somatic conception, and it has nothing to do with conscious guidance and control.
So the similarity those two examples have is they're saying that people need to feel more deeply. They need to feel even more or sense even more, as opposed to Alexander saying you need to feel and sense less. Well, use them less. Don't use them for guiding and controlling purposes. So it's literally the opposite of what Alexander is saying, especially clearly. It's especially clear in the early books.
Yes. Well, it's clear in all the books, really. And it is opposite to the written statements of the principles. It is antagonistic to it. But these people are true teacher of the true Alexander technique at the same time. So we have here two opposing views. One is saying that we, in fact, have a motoric activity that is reducing our senses, and so the idea is to quiet down. And the other one, Mr. Smith, is saying that, in fact, feeling needs movements, and so we must free movements in different parts. What is interesting is the proposed solution is always to, in fact, question the different localization of problems in order to, one after the other, free them. The idea of coordinating several movements at the same time, or several action, or several mind action on the movements does not exist. I want to show you the way out of faulty sensory awareness that is proposed by the second teacher, Mr. Smith. So what Mr. Smith is saying is that what is your way out of this faulty sensory awareness? I think that it is primarily through a process of questioning. Someone may habitually stand with all of their weight on their heels. But if you ask them to bring awareness to their feet and to try to notice how their weight is distributed on their feet, they will be able to tell where their weight is. Of course, 5 seconds later, they will have left this awareness behind and will again be habitually standing on their heels. So their task, when you're not with them, when you're not there to remind them, is to pose certain questions to themselves. Questions such as, what is the condition of my skull upon my spine? Is it settled into a position? Or is it in a condition of subtle oscillation, in which reflexes can play with its mass based upon changing conditions? Bringing awareness to the rib cage. One asks if the ribs are allowed to move during inspiration and expiration. This process of questioning serves to restore the subtle movement required for good sensory awareness. And when you're there to assist, you help to calibrate their proprioception. So, well, this is clearly a somatic approach. I don't see any difference between this approach and many other somatic system of sensory development. You question yourself. So you use speech in order to direct your attention toward specific feelings, one after the others. And what is assumed is that if you direct the feelings and you notice that, for example, the ribs are not allowed to move, then they will start to move. What is not mentioned is, will they move in the correct direction? Will they move relatively to the movement of the pelvis in the correct direction? What is not said is the center of rotation of the movement that will be observed when the person suddenly releases, will that center of rotation be the same as before? Or will it be a new center of rotation? That is this idea that there is a faulty movement or an absence of movement, which is a faulty movement. And if you notice it, it will be, in fact, it will change directly to the correct movement. So you will have this idea of natural movement that will come to mind, that if you stop the wrong thing, well, the right thing will happen by itself. I understand that this idea has gained a lot of ground, a lot of weight in recent years, since the modern Alexander technique with the first generation teacher started, because I think they do not take into consideration the problem of coordination. It's this idea that if you can spot an incorrect activity somewhere, solve it, and it will be fine. That's if you then you can go to another location, another spot. Is there a misdirected activity there? And if it's incorrect, well, it will just, by directing your attention to it, everything will be made correct, will be made fine. It's the end-gaining conception. All that is desired is to employ the different parts of the organism are going to be employed correctly as soon as you release. There is no idea of direction. There is no idea of center of motion. That is how the new movement is going to be seen to perform. I want to explain the difference between perceiving and feeling, because this idea is that perceiving and feeling are more or less the same thing. I think it's absolutely incorrect. They have a faulty understanding of kinesthesia. I've already said that kinesthesia is the perception of movements. Kine means movement, and sthesia is the perception of something. But you have to understand the Greek, or you have to understand how this can be construed reasonably, is that there are two different ways to understand movements, perception. One is that perception is what you feel. So you feel a sensory event, and so you want to give to that sensory event a distinct mechanical explanation. When I feel this, it means that my rib cage is not moving properly. This does not explain how moving properly is construed in your mind. And so there is another way. Instead of having that feeling perception of movement, you can have an understanding perception of movement. It's completely different. One is you're going to do something according to what feels right to you. The other is different. The other is to say, well, it is possible to conceive a movement of rotation around a new center of rotation. And at first, when you will give yourself the orders to rotate again, but this time with a new center of rotation, you will find that the feeling that you perceive when giving yourself the decision to rotate at a different center of rotation will be completely contrary to anything you've already experienced. And as a result, it will feel wrong. There will be new muscle that will come into play. They will not be very happy about it. And they will give you a feeling of strain, which when you watch the video, can be completely different. So I wanted you to help me with something, Kevin. I wanted, there is a simple explanation that is given. I've already gone around it, but I really want for you to, for the listeners to understand what this problem of perception versus feeling leads to, is to start to model a rotation. So could you take a rectangle or a book or anything that looks rectangle? That's it. You don't have any other one that is that would not be black. I have
Yes.
something. I have something against black. It's because that's much. Oh yes, that's one I love. It's a very good model. And so we have a rectangle. So we imagine it's a box, and we see the side of it for the moment. You're showing the side to the camera. Yeah, that's what I see. I see the side. For me, it's a rectangle. I see that the long side is upright, and that the short side is horizontal. Is that correct?
Yes.
Yes, it's correct. Okay, so now we are going to orientate the box. So say that there is a back and a front of the box. So I would like you to take the upper right-hand corner with your right hand. And that's it. And so now we see that you're holding the lower left corner with the left hand. So I will say that the right hand is at the front. So if that was the rib cage of the person seen from the side, I would say that the person is looking to your right. Yes. So could you show your right hand to the camera, please, so that most people who have difficulties with right and left, that's it, that's the right. Okay, so that's forward. And so because this one is forward, it's the top corner, the top forward corner of the box. Your left hand is on the lower corner at the back of the box. Okay, so it's very useful when we work with objects like this to give them a name so that we can remember them easily. So I'm going to call that rib cage box. I imagine in my head that this is a rib cage. And Alexander used an expression, and he says that misdirected activity that is quite common is when there are movements which lead to the upper rib cage, the upper chest, to be unduly lifted. So could you show us what it means to unduly lift the front of the box? That's it. So we see that unduly lifting the front of the box leads to a movement in which, of course, when we say unduly lifting the front, it means that the front is lifted more than the back. We will find that in this rotation, the back is shortened. And so that is an unduly lifting of the box. But you are well, maybe not aware at first that we have seen a rotation, and that a rotation implies two movements. One movement of the left hand and one movement of the right hand. Even if, for example, you could show us again the unduly lifting movements from starting from a neutral where the box is vertical. And you will see that, for example, you can prevent any movement on the right hand. So the right hand stays, it will be seen as center of rotation. And so as you have to have a center rotation at the back of the book for to be able to lift unduly the front of the book. So could you again show us? And some people, when you unduly lift the box now, again, could you do it? Some people would say that there is only one movement. There is only the right hand that moved. Well, in fact, this is incorrect, because if the left hand had not resisted, as if you want to create some movement in the left hand to resist the push to the left, then the book would not have rotated, but just translated, just moved in the same way backward. This requires two movements. So this is the first thing. Very often when you feel yourself rotating the rib cage, you don't conceive movements as clearly. You don't conceive the number of movements. But there is also something else that most people don't perceive, is that there is a center of rotation. Well, in this case, it's quite obvious, and there is a center of rotation. And so I want you to, in fact, continue to use the left hand to support the book, but I would like you to point the right index finger to the camera. We are going to make an axis of rotation. That's it, an axis of rotation. And I want the axis of rotation to be at the back, to be in the center of the back of the book. So the back is, remember, on the left side. So yes, that's it. For most people, when they look at anatomy charts and see a torso, they will see that the main joint is called the spine, and they know that they see that the spine is at the back. And when people imagine movements of anatomical parts, well, they have a tendency to always think that the rotation center should be at the joint. And so when here we have a position like this, I encounter a pupil, and the pupil is unduly lifting the front of the chest. It's very simple to see, because there is a large flat bone at the top of the chest, we call the sternum bone, and it will be seen in this case that the sternum bone is inclined backward at the top. It's absolutely obvious. So when I asked such a person to bring the back, there was an old instruction in the first generation, in the first training course of the first generation teachers, which was back, upper chest, come forward. And so when we decide to move the back, which is the lower rib cage, in your case, it's your left hand, you will find that we create a rotation of the book. So please, could you pull the back, so the left hand slightly backward, and you will find that the book will change. It's a readjustment. Well, there is a question as how to stop the movement before the upper chest goes down, but this is another question. For the moment, if you observe what has happened with the upper chest, you will find that the readjustment has led to the upper rib cage going forward in space, rotation, and down. Could you show us the undue lifting again? Going forward with the lower ribs, protruding the abdomen. Can you protrude the abdomen, rotating around the same center of rotation? That's it. And the top of the book has gone upward and back. The person will have a sense of lifting herself, of being up. Why is it that most people are doing this after 3 years of training course? It's because the idea of up has not been explained as a rotation around the center. And so the person is going backward and up. And so when now you're going to readjust and pull the back, we will see that the top of the book is going forward and down. So this is not felt by most people. They don't monitor the feeling of the back of the ribs and the top of the ribs at the same time. I don't think you would feel much. It's not where you feel. You feel something at the back, you feel something at the abdomen, but you do not feel the parts in movements, and you cannot make decisions regarding this. And there are decisions that are impossible to make with the sensory system, is to make a complete leap out of this way and to think, what if we would change the center of rotation and place it at the front? So instead of having the center of rotation of the rib cage at the spine where your right index is, we are going to place it at the very front. Yes. This came to me because I've seen many pictures and a few films of Alexander, and I started to see that he was rotating the rib cage of the person, rotating at the bottom of the sternum, or roughly. So now, could you show us a person with an unduly lifted front of the chest once again? And now I want you to look very closely at what is happening to the top of the front of the book, which is the right side, is that when you're going to make the readjustment, we will see that now, because the center of rotation is not the same place, now, if you pull the back, you will see that the top of the chest is going to go forward and up in space. Could you do it? That's forward and up in space. Okay. So thank you. I wanted to make that and now you have to imagine when you're looking at this video, you have to imagine, so you can place a finger, for example, Kevin, could you place the right index finger on the lower part of the sternum bone? So you think, okay, I have got the center of my sternum bone. So what is it now to create a movement which will bring the lower ribs backward in space around that same movement? Yes? And you will find that, first of all, there is no tendency of going down either with the chest or the chin or the nose, because when anything happens to somebody, you will find that it's mirrored in many other parts. For example, any movement of the torso will have a distinct, definite movement of the head going up, going with it. So if the person has an idea of rotating, and well, has a subconscious understanding of what it is to go up, it's a subconscious understanding of rotation at the back of the spine, the person will be seen to move down. It's very interesting to see when you start giving instructions, you ask just a person, could you just please bring the lower ribs back in order to rotate the rib cage? You will find systematically that when bringing the ribs back, the person is going to go down. Maybe not so much with the throat, with the top of the sternum, if they know the game, but they will not prevent the chin and the nose from, they have the impression that to increase the movement of rotation, they have to rotate the head, which means that their habitual center of rotation for the rib cage is at the back. We know that because every time the same person is starting to understand that it's possible to make a decision, instead of doing kinesthetic what feels to be right, make a decision. Rotate as if you were making a somersault in the air. You're not making a somersault around a joint. You're making a somersault around a point that is forward of your chest. That's how you have to think it. It's impossible to rotate around a joint and do a somersault at the same time. So this idea of having centers of rotation that are outside of the body is absolutely acceptable. And so then you will find that when you start rotating the lower ribs backward, there is an instant effect on the upper chest. But at the same time, you will find that suddenly your pelvis is like forced to rotate in a certain way. If you don't see it, film yourself. And if you film yourself, you will see that, yes, there are movements that are happening in other places when you decide to rotate a certain object, a certain part of a mechanism. All the other parts of the mechanism are going to move with it. And this is the idea that Alexander develops when he's talking about coordination. So if I can show you, this is what I want to show you. I claim, Alexander is speaking, I claim that the primary requirement in dealing with all specific symptoms is to prevent the misdirection which leads to wrong use and functioning, and to establish in its place a new and satisfactory direction as a means of bringing about an improvement in use and functioning throughout the organism. This indirect procedure is true to the principle that the unity of the human organism is indivisible, and where there is an understanding of the means whereby the use of the mechanism can be directed in practice as a concerted activity in the sense I have defined, the principle of unity works for good. I want to stop a second on this because many people have thought that the misdirection that Alexander was talking was a local misdirection, not a misdirection of the general use, a misdirection of all the movements happening at the same time. And so there are words that are very important. We want to bring an improvement in use throughout the organism. We don't want to suddenly locate whether the ribs are moving or not, see whether we are pulling on the wrist or on the neck, or no. The principle of the unity of the organism is the organism in activity. And so Alexander says there is a reverse side to the picture of the indivisible unity of the human organism in activity. It is in the nature of unity that any change in the movement of a part means a change in the whole system of movements. And the movement of the parts of the human organisms are knit so closely into a unity that any attempt to make a fundamental change in the working of a part is bound to alter the use and adjustment of the whole chain of movements. This means that where the concerted use of the mechanism of the organism is faulty, any attempt to eradicate a defect, otherwise than by changing and improving this faulty concerted use, is bound to throw out the balance somewhere else. Alexander is really belaboring this idea that it's not a specific movement, it's not a specific feeling. The question is that all the movements are really an indivisible unity. It's impossible to change use, to change. Sometimes people use the word posture, for example, or postural reaction by directing your attention to different parts, one after the other. The idea behind the faulty sensory appreciation is the problem of coordination. That's what I wanted to stress today. And so somatic techniques are for me engaging techniques. They have very little to do with well, of course they offer the world, they offer everything, they offer much more than what we can discuss here, and of course because they are somatic, they can. We can only offer this idea of starting to work with your mind to have an attention on a series of verbal instructions that are going to be checked on video to see whether they produce the correct coordinated series of movements preliminary to any act. That's where effectively initial Alexander technique is very limited. The Alexander technique does not proposes delight in life or anything that fantastic.
So it's the difference between feeling specific parts more deeply versus feeling the specific coordinations or parts versus understanding the general coordination, which is why Alexander uses the word general.
Yes, and understanding the technical aspect. We teach a technique, and you must understand that we need to deal with the geometry of the movements, how the different movements are have to be conceived together to produce the real expansion of the torso we are looking for. And this means that all the time spent in nice philosophy and friendship and enjoyment has no place. So it's necessary to understand that principles cannot be felt, that the principles of movements are not something. It's not because suddenly somebody has done something to you with his hands that you understand the principle of a movement. No, you have felt a new experience, you have understood nothing, especially if the person is good enough and can or coordinate at least two movements instantly. If a person is in fact experiencing a different rotation of two parts at the same time, the person's sensory system is going to be overwhelmed, and the person will be in awe, in wow, this is extraordinary. Yes, this is extraordinary, but this is not technical. The person has understood nothing of the movement, and as the person has understood nothing of the creation of the movements, well, she will never be able to recreate the movement by herself. So I maintain that the person has not learned. I maintain that the somatic system does not teach. The somatic system gives very nice experiences, but it does not teach so that the person can by herself, by her own means, reproduce the activity that is required to obtain the new coordination.
Okay, Super, Jeando. For everyone watching, you'll get a link to Jeando's website and where to go if you want to book a lesson with him. And we will see you in the next video. So thank you a lot, Jeando.
You're welcome. Bye.